Namaskar. Welcome to Quest Diagnostics.
When people have a difficult problem in diagnostics, they come to Quest Diagnostics. When you have the expertise like we have, with so many MDs and so many PhD and so many patients we test every day, we have acquired knowledge base which is not available anywhere in the world.
We can help you take care of patients with chronic diseases ranging from HIV to hepatitis B to hepatitis C to patients with acute infections.
We can tell a patient that they're not at risk for getting the same kind of cancer that their brother or sister or mother had.
Every year, there is approximately 250,000 women die unnecessarily because of cervical cancer. Quest Diagnostics is the leader for providing testing for cytology as well as HPV testing.
Making the diagnosis helps you determine what therapies to use, helps you avoid invasive procedures, unnecessary surgeries, saves money, and the bottom line is can potentially save lives. When I first started as a clinician, I thought all laboratory testing was the same. I'd order a test, I wouldn't know where it would go, who would do it, but I learned through the course of my career that it makes a difference.
It's easy to generate data, lots of data. What's difficult in many cases is to help somebody understand exactly what that data means. A good example is the HepaScore test. We take a series of tests that are very complex and describe in a single graphical report exactly what the risk is that that patient has liver fibrosis. So the physician can get an instant insight into what needs to be done for that patient.
When you do high volume testing, you see even the rare things frequently. When a physician calls us and asks us a question about a disease that he or she may never have seen before, I've seen 50. We have that ability to advise our physicians in a much better way.
Hello, Dr. Jones.
We have our medical directors who are on site who can actually be available for any physician who has received a patient result and might not know what next steps to take.
When the patient comes to the doctor, the patient just knows that there's something wrong, and in many cases they worry about the absolute worst possible scenario.
We want to do whatever we can to reduce that anxiety time and provide them with the highest quality diagnostic results.
The patient really is behind everything that we do here, whether it's developing the right test, whether it's to be able to provide results as quickly as possible, whether it's putting in that extra bit of effort to be able to take a very unusual case and help the doctor and patient figure out exactly what's going on.
One of the things that most impressed me when I joined Quest was the focus on quality.
No matter where the testing is done within Quest Diagnostics, it's always done the same way, at the same level of quality. Six Sigma is utilized in all aspects of our business, starting from the time that you collect the specimen, to the time that you deliver the specimen, to the testing, to the reporting, and even the way that you look at your workflow.
We've also made tremendous strides in automation. Automation has huge advantages, both in terms of quality, since the consistency of robotic operations is much better than even the best lab technologist.
You have to have accurate results, but deliver them in a fast enough time period that the physician can make the right decisions to treat the patient.
Clinicians as well as patients trust that when they send their sample to us, it is in good hands and they are going to receive the proper and accurate data.
The question of trust in India is a very important question. People want to have the same expertise as we have in the United States, and the trust comes from the feeling that we are now getting the same American quality and technology and medicine in India.
There's a big difference between R&D and innovation. R&D is incremental, moving forward, using things that are obvious to most people. I'm an innovator, and we're innovative here.
We came up with a new line of testing. We call it Lometa.
Lumeda is a test for leukemia and lymphoma, but it is a test done from blood plasma instead of bone marrow. So if you have seen a bone marrow biopsy, which is the most painful procedure one can see, and especially with the children, and there is an opportunity that you can do similar tests from blood samples, it's tremendous.
Nichols Institute is an astonishing place. It's much more like a research institute than it is a service laboratory.
One of the things that makes infectious diseases so interesting is that viruses, bacteria don't obey geographic borders. We live in a very small world. It's a global society. Many of these infections are only a plane ride or a mosquito away. We were the first company in the United States to offer an assay against SARS. We're the first company to offer an assay against West Nile virus.
This is the only company which offers the cystic fibrosis. It's called CF complete testing for the whole world.
Quest Diagnostics is a leader in providing companion testings for therapy in cancers. For example, HER2 testing in breast cancer is crucial to predict whether the patient is going to respond to antibodies for the HER2, as well as to some of the new targeted therapy.
We developed a completely new way to diagnose the most common inherited form of mental retardation, which is called Fragile X syndrome. We have a way of doing in a high throughput, cost-effective manner screening for carriers of Fragile X syndrome. This was one of the holy grails of genetics. That's innovation.
We have 43,000 dedicated people, and the reason they come to work because they know they are doing something that's helping patients.
We're foremost part of the healthcare team, as much as the doctors, the nurses, and people who directly interact with the patient.
When you look at a country like India, we see not only the opportunity for business, but also opportunity to bring our expertise and experience to a population where there's a pent-up demand about healthcare.
Every day when I go home, I feel I did something for patient care, which makes me proud.
I've been with the company for 20 years, and if I would want my sample to be tested or my child's sample to be tested, I would only want it to come to Quest Diagnostics.